Thanks for asking me to come and talk today. As you say, my name is Kate. I'm an OT and I work in vocational rehabilitation. And we do see all different neurological conditions. We're an outpatient service with a neurologist, occupational therapists and clinical psychology. And then we link to other disciplines for support as needed. And within the different neurological conditions that we see, actually people with brain tumours are our third largest group of patients that we see after multiple sclerosis and stroke. So that's my chart. These are the aims of the session this morning. I just wanted to get you to really think about why work might be important for the people that you're working with. Think about why people with brain tumours might leave work. Tell you a little bit about what vocational rehabilitation is, although I'm hoping that you already know that and this is just a bit of a refresher. And then perhaps think how you might be able to address work issues in whichever role that you're working in. So I wondered whether to start with, you could just have a little 10 seconds, 20 seconds, half a minute to have a little chat in your tables about what work kind of means to you. And then I might get a few of you to shout out, but it's quite a big room, so just have a little think. I'm going to get you all to come back now. I think that was a bad idea. There's too many of you, too much talking. Maybe, does anyone want to shout out some things that work might mean to them? Identity, yeah, definitely. That's a really big area.
Financial.
Yes, of course. Money is very important. Anything else?
Social.
Yeah, lots of social interactions that people might get from work. Any other things? Purpose, yeah, and that probably really links with identity as well, doesn't it?
Achievement.
Yeah, sense of achievement. You can feel like you've really maybe done something good in your working day.
Independence.
Yeah, independence. Cool. So there's loads and loads of different things, and that, you know, it gives that kind of structure and sort of purpose to our time. But I suppose what we're thinking about with work is what are the good things for work, because maybe it's not always good. It does give us that sense of identity that you've talked about. It gives us our social connections. It really helps with self-esteem, confidence. Hopefully we're competent in our job roles, and it does really structure the day. And I think when people aren't working, often that daily structure can go very, very quickly. But equally, work can be stressful. You know, today's maybe a more stressful work day for me than normal, having to come and talk to you. It can be depressing or boring. Maybe there's sort of bullying in the workplace. So we want to really think about what good work means for people. And that can be characterized by quite a few different things, really. So maybe job security, work that's not monotonous. You have to think about whether your work kind of fits within these areas. Some of my colleagues at the back, so obviously mine does fit within all these areas. Autonomy, maybe an opportunity to be creative, kind of having a balance between the effort that you're putting in and the reward that you might be getting from work, having the proper skills to do the job well, kind of support to cope in periods of pressure, having a safe and healthy working environment, strong workplace relationships, and kind of having that attention to a decent work-life balance. And I think that's a really interesting one, because I kind of spend a lot of time asking people what the hours are that they work. And I say, okay, well, what are your contracted hours? And they tell me. And I say, oh, and what do you actually work? And they tell me, and it's very, very different often. So it's trying to get that work-life balance can be really difficult. But there's lots of government drivers for people to stay in work. I don't know if people have read Dame Carol Black's report from a few years ago now, which is about working for a healthier tomorrow. There's lots of evidence that says that work is good for our health. And the government really want us to stay in work for, you know, whatever the cynical reasons we might think that might be. But actually it is really good for us. You know, people that are working use the GP less, they use sort of lots of psychological services less, and they're kind of using the benefit system less. And this kind of led to the change in kind of a few years ago, the change from sort of incapacity benefit to employment and support allowance, the change from sick notes to fit notes. So trying to kind of be more positive in terms of the terminology for people perhaps with disability working. I mean, and you know, how that's actually working in practice is probably something that we can debate at another time, but it is there in terms of the underlying principles. And that's kind of underpinned by the Equality Act, that people with a disability should be protected to kind of be in employment, and employers are obligated to make reasonable adjustments to support people to maintain their working role. And that gets tricky because what's reasonable in one job is not reasonable in another job, but it's there kind of, again, underpinning people's working roles. And as I said, I work in wider than sort of people with brain tumours, and having said all that about work being really good for us and the government wanting people to stay in work, we know that for people with all neurological conditions and for brain tumours, that's kind of not always necessarily as simple in practice. And when you look at the evidence, people with all neurological conditions, they kind of leave work quite quickly and not necessarily related to the level of disability that they might have. So people with TBI, kind of perhaps only 40% will go back to work, and the same sort of numbers for people with stroke that are of working age. People with multiple sclerosis are mostly in employment when they're diagnosed, but they come out of work very quickly, and sort of 20 years down the line, there's only a very small amount remaining in work. And for people with cancer, they're kind of 1.5 times kind of more likely to be unemployed than the wider population. So really, why do people leave work? And I think, you know, these are probably make sense to you all really. It's about the impact of their kind of symptoms. So the complexity of either their physical disability, their cognitive difficulties, the emotional problems. Fatigue, as we've just heard about, is a really big reason that people leave employment, and it's often those subtle and invisible symptoms that people find hard to manage within their working environment. They find it hard to explain that to their employers, and people sort of have a wider attitude about if people have a brain tumour, oh, you know, you shouldn't be working now. You know, people will often be told you need to eliminate stress completely from your kind of life, so you shouldn't be working because that would be really stressful. So perhaps they've got a perception from whoever they might be kind of speaking to, from either from the medical profession, the therapists that they're working with, or from their families or their employers about why they should or should not be working. Maybe their job role might have changed. A big area that's difficult for people is if when their line manager changes, it might be that they've been in employment, they've been managing really well, the people that they're working with really understand their symptoms and kind of accommodate for those, and then something changes that can really upset that, and people can then come out of work quite quickly. There might be a lack of flexibility to accommodate any changed abilities, or an unwillingness to be flexible, either from the person themselves or from their employers. They might have kind of previous negative feelings, I suppose, against work. And this is something that we've learned kind of working with people, that we sort of often take it on face value. They'll say, oh, this problem has been happening at work. They're not kind of supporting me. And actually, when you pick it apart a bit more, they've kind of perhaps had problems for quite a long time, even before whatever kind of neurological condition might be impacting. So it's quite useful to sort of explore some of those areas. And often people do change their kind of life goals and their kind of priorities. Maybe they don't want to work at this point, and equally that might be the right thing for them. Or sometimes that experience of illness is just too overwhelming to kind of add work kind of into the mix too. But really, for lots of people, like we talked about at the beginning, in terms of identity, work might be that only thread of normality that they feel they have left. So it can be really important to support people who want to return to work to do that. A few years ago now, the National Cancer Survivorship Initiative did a big project around vocational rehab, and our hospital was lucky to be one of the pilot sites which actually developed into the vocational rehab service that we run now. And that identified this model sort of across all cancers, that everybody really should be provided with information kind of and signposting about work. So anyone who's in work or has the kind of capacity or might be thinking about return to work should be really asked about employment. The next level might be people that have sort of specific concerns about work or worries about work, and they should be provided with support around self-management. And then there's the final group that have perhaps more complex needs, and I think often because of that, the crossover of physical, kind of cognitive, emotional symptoms that people with brain tumours might often link into this bottom category is around kind of requiring more specialist vocational rehab support. And this has led on to the REJOIN study, which is a vocational rehabilitation and cancer study that's going on at the moment, which hopefully will give some kind of wider evidence to support this as an intervention. So what is vocational rehab? Now, it's not very complicated. It's whatever helps someone with a health problem to stay at, return to, or remain in work. So probably lots of you could say you're providing elements of vocational rehab if you kind of fit with this definition. And the evidence really about vocational rehab talks about proactive and timely intervention. So what we don't want to do is kind of get involved when someone's already kind of handed their notice and decided to leave work, or they've already kind of had a disciplinary hearing at work because they haven't met their deadlines because they hadn't told them about their kind of cognitive concentration problems, those kind of things. The information is required at all stages. That specialist care is often more effective. The early disclosure, was a study in MS, is beneficial, but I think that kind of carries really for all conditions. And that the people that receive kind of vocational rehabilitation input find it really beneficial to have someone that understands their symptoms and how to manage them in their workplace. Helps to kind of remove anxieties about how they might engage with their employers about their neurological condition, kind of managing loss of confidence and giving, I guess, helping them to improve their employer's understanding of their condition. So we think about a few different pathways of vocational rehab, and I haven't talked about study yet, but actually that's a big area that we would work on with people as well. So we see people that are working, but also people that are at university or college or school as well. We'll see people over 16 years of age. And there's the three different kind of pathways really around someone that's got a job. So that's the work, study, or retention. So they might be in work and struggling with the impact of their brain tumour. They might be off work and so they might be off sick and thinking about going back. Or they might be thinking about going back, to their own job role. Or maybe they can't go back to their own job role, but they would look to be redeployed within their own kind of organisation. The next pathway are people that are unemployed. So they might need support with kind of pre-vocational skills to build up their kind of tolerance to then start to seek new employment. They might need that kind of support on a more kind of formal basis as to how to kind of manage their symptoms while they're looking for new work. Or they might need support to kind of access different kind of meaningful activity, not necessarily paid employment. And I think this area is much more difficult, and it's often an area of vocational rehab that is a little bit lacking because you need different people that you can link in with, really, perhaps sort of job skills, CV writing, job coaches, kind of brokering kind of skills that aren't necessarily available within lots of vocational rehab services. And then the final one, which is actually really important, is exiting kind of work or study, but doing that in a really positive way, for people to feel like they're making that decision for themselves rather than it being forced upon them. So that's an area that we would work with really, kind of the two streams that we would do is around the job, study, retention, and the exiting work or study, to help them kind of think that through and maybe support them through the ill health retirement process. So just in a bit more detail, these are the kind of things that we would do within our vocational rehab service. So the same as all of you probably, we start with our assessment, and that would be about their brain tumour and how that's impacting on them, and then also about their job role as well. So finding out about that in terms of, what it is, how many hours they do, what the travel is, what the environment is like at work. Is it very noisy, very busy? Do they have to be, I don't know, going up and down ladders? Do they have to be in an office? All those kind of things. Then there's lots of work really around information provision. So the kind of things that we would tell people about is their rights under the Equality Act, talk about reasonable adjustments. So that might be things like, say in terms of fatigue, it would be a reasonable adjustments that people can have regular rest breaks to manage their fatigue in their working day. It might be reasonable that they have access to a quiet room to have their rest breaks in. It might be reasonable that they can work from home. The thing with the adjustments is it's not reasonable necessarily for me to work from home because I need to be able to see my patients face to face. So it has to kind of fit within people's working role. We might give them advice about access to work, which is a government scheme to support people with disability in the workplace. So they would do lots of different things. They might provide people with a taxi to get to and from work if using public transport is difficult or if it causes a lot of fatigue. They can do workplace assessments. They can provide a support worker. There's lots of different areas. Often information provision is a lot about disclosure. People can be scared about disclosing their condition, perhaps scared about disclosing the severity of their tumour and what that might mean, and perhaps linking them in with local resources. So the generic work skills are things like fatigue management, which we do a lot of. We might do kind of cognitive assessments and then kind of cognitive rehab strategies, behavioural management, managing mood, and that's why it's really good within our service. We can work kind of jointly with the clinical psychologist in the team. And often we do a lot of work hardening, so getting people ready to go back to work, so helping them think about the structure to their day so that they're ready to then sort of add work back in. In occupational therapy, we would think about analysing a task that someone is going to do, and then we would sort of apply those same principles to what their job tasks are, and then think about how that might match with their kind of symptoms, really. So if they are very desk-based, thinking about, okay, well, how long can you sit and work on the computer for? What is it that is making that difficult? How can we kind of manage that in a different way? And then liaising with their employers about that. Which brings us on to the liaison with the workplace. So we do a lot of writing letters to work. Hopefully they read them. We can go and meet with people's employers and have those face-to-face conversations about their condition and how to sort of support them to manage that in the workplace. So I was just going to whiz through a couple of kind of case examples just to put things into context. This lady we worked with over probably about 18 months, and she had an oligodendroglioma. And she worked in for one of the big pharmacy companies, actually, sort of in a clinical trials lead and sort of brand management role, and had quite the tumour impacted on these different areas in terms of speech, sort of fatigue, speed of processing, reduced attention, and sort of difficulty with problem solving. And she was off work for a good chunk of time, and they'd got kind of contractors back in place of her. And also her manager had changed while she was away, so the new person didn't know her, and he was sort of based in France and she was based here. And so really a lot of the work that we did was around the work hardening, so getting her ready to get back to work and getting her to test out her skills in preparation for return to work. And then helping to liaise with her employers about her going back. But a lot of it was, from the psychology perspective, was around her kind of finding her place again within the company, whilst she was sort of living with the tumour and managing her symptoms. And she has gone back kind of really successfully, but wasn't really able to go back into quite the role that she wanted to, but was able to kind of get back in a meaningful way. And I think it's just worth thinking about sort of how people do kind of fit back in sort of when they've been out of work after a period of time. The next chap works in antiques, and he has a glioblastoma. And when he came to us, he was still in work and actually didn't really have very much time off work at all. And again, the main problems are around fatigue, kind of attention, and a lot of the people that we see, it is these kind of really subtle problems that impact on them at work. And he was someone where he they were aware of his diagnosis, but he hadn't really kind of agreed, these are the hours that I'm going to be in, this is the roles that I'm going to be doing. So it was all a little bit woolly. He was sort of working part-time, but actually really working full-time, struggling to think about how he was delegating his tasks and really using all his energy on work and then not really being able to engage with his family. So a lot of the work that we did was around thinking about kind of that work-life balance and getting some clarity of, okay, well, this is the time that you're going to be in work. So what can you actually do within that time? How are you going to share that with your colleagues? How are you going to delegate? And people often just need some time and space to kind of think that through in a structured way, really. And one of the problems for him as well was getting his insurance scheme, because they kind of said, well, actually, you've been here full time. But when we looked at it, he was actually really only working kind of reduced hours, and it was quite hard to get the evidence for that, to get the money through for the insurance scheme. I've only got 10 minutes left, so I'm not going to talk about this chap. I'm going to think about what you can be doing. Because having said all that, not everybody out there is getting help to return to work or to maintain their work or to leave work from kind of the services that they might be linking in with. Because we've all got different remits. I'm really lucky. I only have to talk to people really about their work. But that's probably quite a luxury kind of place to be for the people that get linked into our service. And probably for most of you, that's not the primary area that you're working on. And lots of people, their medical conditions, obviously their medical services are focused on their treatment. That's really appropriate. Occupational health is limited to larger employers, so people might not get that support. The NHS rehab services are often focused on hospital discharge, and vocational rehab is quite a sporadic thing and not very well funded, even though it is a quality requirement in the National Service Framework for long-term conditions. And the Department of Work and Pensions is really concerned with sort of benefits, and I think we all know people have very variable experiences in the job centre. So what can you do within your services? And I think the main thing is to really be asking people about work. It might not be the kind of the number one priority of your role, but it's an important question to ask because people will often be worrying about it. We've talked about those things at the beginning, even from that financial perspective, but much wider, people will be worried about work. So asking them some of these basic questions can be really important. Are they working? Are they struggling? Do they know what their rights are? And kind of, do they want to work, I suppose, really is one of the really key questions. I would get you to kind of just tell people that they're entitled to statutory sick pay and they're entitled to have some time off and they're entitled to take some time to make decisions about work. I think people have a diagnosis like a brain tumour, and obviously that's a massive kind of event, and they quite often will make some very quick decisions. Okay, well, I can't work if this is what happened. I need to do this. But I would encourage them to take some time, not make any decisions straight away, and really kind of take time to weigh up the pros and cons, have those conversations, and think about whether work is right for them. And really encourage them to keep in kind of open lines of communication with their employers. They don't have to tell them everything what's going on. They don't have to disclose their diagnosis, but they do need to give them their sick notes, and they do need to kind of keep in contact with them, else they can kind of get into trouble. You can kind of inform patients that they are entitled to reasonable adjustments. Most people with brain tumours would be classed as having a disability under the Equality Act, so they are entitled to reasonable adjustments when they do return to work. You can help them to think about disclosure of their diagnosis, help them to think about what they might want to tell their HR department, what they might want to tell their line manager, what they might want to tell their colleagues. How might they want to do that? Do they want to, have everyone round for a cup of tea and tell them, or do they want someone to send a brief email? You can kind of have a few conversations with them about that. Obviously, any kind of symptom management that you're doing will be really important, and you could perhaps think about that in relation to their work role, and you can try and find out if there's any specialist vocational rehab services in your area that you can refer on to. And then you can also think about who you might signpost people to. And these are just some various services. This one at the bottom, actually, I don't know if people have heard of Fit for Work, which is a new government sort of occupational health scheme, actually. So for people that don't have occupational health, that aren't in those bigger employers, there's now this government scheme which is triggered at 4 weeks of sickness absence that people should then get linked in with an occupational health provider. Haven't had much dealings with them yet, really, so I don't know their understanding, I suppose, of their neurological conditions or brain tumours, but it will be interesting to see. And it's really a government scheme to stop people going on ill health benefits. So, there's always an underlying reason for these government-led schemes. But having said that, there's a lot of good information on the gov.uk website. All the information about access to work is on there. And there's obviously information about statutory sick pays, information about employment and support allowance that people might want to access. Macmillan have some really good work booklets that you could use. If people are thinking about kind of work hardening, getting ready to go back to work, or work's not really the right thing for them, volunteering is a really great opportunity for people, and the Do It website is really good. There's also something called Time Bank as well, where people can kind of share kind of skills in their local community. Obviously the job centre is there, and the government programme to support people with a disability back into work is called Work Choice, and you would link with that through the Disability Employment Advisor at the job centre, although they're becoming a bit of a dying breed, unfortunately. But if there is a Disability Employment Advisor, then that might be someone to link in with. So I think I'm about done for time, but really I suppose the take-home message that I wanted to impart to you is just to really think about work. You know from yourselves that work is, important. It's not the be-all and end-all, but it can be really important for people with brain tumours to maintain. And if we can encourage them with that, I think that would be really beneficial. So just like I said, if you can ask those work questions, I think that would be really, really helpful. Thank you.